move on now to the Sydney Morning Herald, where there is another regional yarn that should make our blood boil. Hospitals unchecked and results led to cancer cases. The growing scandal over a flagship regional hospital's failure to check test results has deepened amid revelations the mistakes led to 3 missed cancer diagnoses months after a major review sparked by a baby's death. The cases at Dubbo Hospital include a woman who turned up at hospital multiple times in pain but was not informed a scan had shown a suspicious growth, which later turned out to be terminal liver cancer, and a year-long delay treating a man's testicular cancer because scan results were not acted on. Daisy, the fury in my body at this point in time is probably going to need to put me on some type of high blood pressure medication, but this annoys me so much when these sort of simple things are missed. And I know you cannot blame frontline staff, but surely stuff like this, where it's easily avoidable and now it's really deeply impacted, a lot of people's lives.
Yeah, I agree with you on the rage factor. This honestly makes me want to smack my head on the desk in front of me. It is so enraging how this can be allowed to have happen. What is going on with the administrative staff in this hospital? As you said, you can't blame the frontline staff, but there is obviously bureaucracy within that hospital that is failing on several levels, and it is literally costing people their health and maybe their lives. This is absolutely insane. We live in a country, and I know I'm a broken record on this, but we live in a country with a public healthcare system that is supposedly the envy of the world, for which all of us put so many of our tax dollars into via that Medicare levy. I expect it, to work for that kind of tax burden. And when I say work, I mean I expect the bureaucracy of hospitals and the administrative processes to inform people when they have a suspicious growth that turns out to be cancer, and to give people their testicular cancer scan results. I mean, it is just like a Monty Python sketch or something, but completely disgraceful, and it should never happen.
So, Jenna, the wider story here, I think, is more the regional-urban divide. So, and this is likely this is likely to be something in the upcoming state election too, and it sort of overlaps with the pandemic, where more people are moving regionally. Yet, I mean, a lot of these missed things are probably partly about not getting access to high-level radiologists at the same rates as one might in a big city hospital. So I think it's more, I think the real point is the great gap a lot of people in rural regional areas suffer, whether it's access to a GP or access to specialists within a hospital setting. I think that's the sort of undercurrent of this story, and it is likely to be one that grows coming up to the New South Wales state election.
Absolutely, and that should just be a message to the National Party, the One Nation Party and Shooters Fishers Party. Get off your cultural war games and focus on the stuff that actually matters, because this is absolutely a vote winner if you can turn this around, that's for sure.